Hello, everyone, and thank you for your time this morning. We have a wonderful presentation for you. For those of you who are joining us for the first time today, the California Local School Wellness Policy Collaborative is a group of representatives from school wellness-focused organizations whose purpose is to implement highly effective local school wellness policies in California schools to support student health and academic achievement. This is our fourth Winning at Wellness webinar this school year, and the purpose of this series is to share information and resources intended to support partners in their school wellness work. Today's webinar will discuss the important contributions of school nutrition programs to improving students' mental health and addressing food insecurity. Slide, please. Before we begin, I want to go over some general housekeeping. Audio connection is through your microphone and speakers of your computer or mobile device. If you are having audio difficulty, be sure to click audio in the toolbar at the top of the screen and click audio connection in the drop-down to check your audio settings. We ask that you please keep your microphone muted to eliminate background noise. Time has been reserved at the end of the presentation for Q&A. Please use your chat box to submit your questions to the host at any time during the presentation. And lastly, a link to the webinar recording and a PDF of the presentation slides will be emailed to you. Slide, please. Thank you. And now I would like to introduce today's speakers, who are also the California Local School Wellness Policy Collaborative co-chairs. Shannan Young is a registered dietitian nutritionist and program director of food systems and access for the Dairy Council of California. Crystal Young is a nutrition education consultant for the California Department of Education Nutrition Services Division. Without further ado, I'll hand it off to Shannan so we can get started.
Thank you very much, Jerry, and welcome everyone to our Winning at Wellness webinar. And I want to start with looking at what May is. And May is Mental Health Awareness Month, and it's a great month to really serve as a reminder on the importance of taking care of ourselves and those around us. It's also a time for us as leaders in nutrition and wellness to be reminded of the important role school nutrition plays in our students' mental health. The pandemic has caused stress for our children. Stress is exhibited in many ways. It can cause feelings of fear, anger, sadness, worry, changes in appetite, changes in energy, difficulty concentrating or making decisions, difficulty sleeping, physical reactions such as headaches, body pains, stomach problems. It could also worsen chronic health and even mental health conditions. Also concerning, eating disorders in teens have risen dramatically this past year, with health officials saying that the demand for eating disorder treatment is way outstretching the capacity to address it. So with that, today's webinar, we're really going to look at the impact of food insecurity on student mental health and the role of school nutrition programs in supporting student mental health. We want to look at the importance of students' optimal growth, development, and academic success related to this. And then finally, we will review school wellness policy resources that support you and your school wellness work. It should go without saying, but all school nutrition employees who have been working nonstop since March 2020 to ensure that students are fed deserve to be called heroes. School Lunch Hero Day was the first week of this month, and I hope you took the time to thank your school lunch heroes. The last year has changed many things about school meals and has solidified the important role that school meals play in supporting students and your community. One change is how school meals and the dedicated people who prepare, pack, and serve them have been in the news. This pandemic has highlighted the value of school meals in the community, School meals have always been a critical access point for healthy foods for children, but during the pandemic and with the economic hardship families are facing, these meals are more important now than they've ever been before. So what I would like to do is first look at the difference between food insecurity, hunger, and then also introduce the term nutrition security. Food insecurity is defined by the USDA as a household level economic and social conditions of limited or uncertain access to adequate food. The terms food insecurity and hunger are often described for the same thing, but they're actually different concepts. A lack of food results in hunger, which describes more than just hunger pains that we are familiar with. It also refers to the emotional and mental feelings that result from not having enough to eat. A newer term being used is nutrition security, and it's defined as a situation that exists when people at all times have physical, social, and economic access to sufficient, safe, and nutritious, and that's the key right there, nutritious foods that meet their dietary needs and food preferences for an active and healthy life. I would like to propose that school nutrition programs are a source of nutrition security for our children and throughout the pandemic, also for families in our communities. This image came from Feeding America's report on the impact of the coronavirus on local food insecurity, which provides an analysis of the potential impact of COVID-19 on food insecurity throughout 2020. The report states that before the crisis began, more than 35 million people, including nearly 11 million children, lived in food insecure households. And that was pre-pandemic data. It is much dire now that we are in and hopefully starting to see the end of the pandemic, but the ripple effect continues. And they're expecting to have continued food insecurity at high rates even before the data was collected for the 11 million children that were found food insecure pre-pandemic. Additionally, a report released by the Robert Wood Johnson Foundation indicates close to 1/3 of parents report they've had to cut back on spending on food this past year, and 33% reported experiencing food insecurity. The school environment, because of this, and even before all of this, has become more holistic in its approach to education and supporting students. The discussion we are having about food insecurity is an indicator of this. The whole child approach nurtures and supports all areas of a child's learning and development. The whole school, whole community, whole child model, which is commonly known as the WISC model, and you'll hear me repeat that often, is student-centered and emphasizes the connection between health and academic achievement. The WISC approach aims to improve collaboration between educators and the leaders and the health sector to improve every child's cognitive, physical, social, and emotional development. As we all know, establishing healthy behaviors during childhood is easier and more effective than trying to change unhealthy behaviors during adulthood. So schools play a critical role in promoting the health of students and helping them establish lifelong healthy eating behaviors and health behaviors. Crystal's going to be delving into the adverse childhood experiences, otherwise known as ACEs, at a greater length in just a few minutes, but I will briefly address them here. In recent years, there has been a focus on the role of ACEs on children's health and learning behaviors. ACEs are defined as risk factors that include, but are not limited to, abuse, domestic violence, discrimination, death, or incarceration of a parent, or mental illness of a household member. ACEs can be a single, acute event, or can be chronic and occur throughout childhood. High numbers of ACEs correlate with a person's poverty, education, and employment. Addressing and understanding ACEs is part of the big picture approach to student health and wellness. Research has shown ACEs are much more common in children coming from food insecure homes, with 1 in every 4 food insecure child having been exposed to 3 or more ACEs. Food insecurity has a number of negative health consequences. Poor nutrition can affect physical growth and maturation rates. It affects their cognitive development, their behavioral health problems. This strong association between exposure to adversity and household food insecurity suggests that the US has a serious crisis in child health. And experts on ACEs and food insecurity have linked the experience of both as a form of brain injury. It is recommended that the solutions to this crisis should integrate approaches that address both exposure to violence and discrimination, as well as more financial resources so that families can afford food. ACEs are a form of toxic stress. Sleep, exercise, nutrition, mindfulness, mental health, and healthy relationships are some of the evidence-based interventions to address toxic stress. When you have an overt stress response, there are changes and impacts on the brain, the immune system, and the hormonal system. Interventions can minimize these stress hormones, which can reduce inflammation and regulate against some of the cellular and oxidative injury that we see with toxic stress. Every year, 46 million children experience toxic stress through abuse, crime, violence, food insecurity, or psychological trauma. By taking a whole child approach, using the WISC model, caring and nurturing school environments can help buffer the effects of these toxic stresses, allowing children to grow, develop, and learn in spite of adversity. Research has highlighted the connection between food insecurity and behavior and the critical role that the federal nutrition programs play when addressing these issues among school-age children and adolescents. As mentioned in the previous section, nutrition is an evidence-based intervention that can buffer toxic stress, and of course, we're all concerned about the impact of nutrition on our youth's physical and mental health. Nutrition and mental health are interrelated. Not getting enough of certain nutrients can also lead to decreases in energy and mood. Iron deficiency is an example of this, which can cause depression. It can cause sleepiness, lack of concentration. Also, families who do not always have access to food experience stress related to hunger, and we know stress can negatively affect our health. There are different types of stress, all of which carry physical and mental health risks. A stressor may be a one-time or a short-term occurrence, or it can happen repeatedly over a long time. Over time, continued strain on your body from stress may contribute to serious health problems such as heart disease, high blood pressure, diabetes, and other illnesses, including mental disorders such as depression and anxiety. Hunger also affects our ability to concentrate, which is very important for students because a lack of the ability to concentrate in class, whether it's in person or online, will affect their ability to engage, to learn, and to be academically successful. A research brief released by FRAC, Food Research and Action Center, entitled The Connection Between Food Insecurity, the Federal Nutrition Programs, and Students' Behaviors, states students who live in food insecure households can have multiple disadvantages in school when compared to peers from food secure households. Food insecurity negatively impacts the social, emotional, and behavioral development of school-age children and adolescents, and exacerbates their risk for behavioral issues that interfere with learning and achieving academic success. The brief further outlines how food insecurity inhibits students' social skills and increases the risk for additional mental health issues and challenges. For example, food insecurity impairs a child's ability to develop interpersonal relationships, maintain self-control, and welcome new learning opportunities. There's also recent research published by the Journal of Nutrition that found that the severity of household food insecurity is positively associated with mental disorders among both children and adolescents in the United States. These results suggest that improving household food security status has the potential to reduce mental disorders among our youth here in the US. Social determinants of health indicators such as food security and accessibility to nutritious foods also have serious impacts on child's well-being, physical and mental health, which impacts school attendance and academic performance. When looking at absenteeism and long-term health, there is a connection. The effects of chronic absenteeism leads to lost learning that can last a lifetime and negatively impact not only health, but education, financial stability, and ultimately employment and adulthood. Research has shown that individuals who are well educated are more likely to live longer and healthier lives. And they've also found the opposite to be true. Adults with fewer years of education are more likely to die prematurely, engage in unhealthy behaviors, and have higher rates of diabetes and obesity. Skills that buffer stress and improve academic projections are being prioritized here in California. Dr. Nadine Burke-Harris is the first California Surgeon General, and she has a focus on how childhood trauma affects health across a lifetime. She is quoted as saying, "As we're thinking about how to help students be successful, we must recognize that what we put in our kids' lunches or provide in school environment makes a difference in a child's ability to regulate stress responses." Nutrition security is one way to help lessen trauma in our students. Trauma wreaks havoc on all parts of our biology, including our food choices and access to food. This is why supporting children's social emotional learning through nutrition programs is so important. To highlight how school nutrition policies and practices can support social and emotional school climate, social and emotional learning, the CDC, I should say, Center for Disease Control, created this infographic that includes strategies schools can take through this lens. It's a really great infographic with good information to share out with your administration as well as your families in your community. It talks about how using school nutrition policies and practices are part of your district's social emotional learning program to support self-awareness, self-management, social awareness, relationship skill building, and responsible decision-making. Along with the alignments shared here on the CDC chart, I am sure you and your teams can identify more ways that school nutrition programs can support social emotional learning. The role of federal nutrition programs in reducing food insecurity while providing nutrition security among school-age children and adolescents is critical. And as I've been sharing, it also supports that SEL happening in your schools. Now, we all know that COVID has impacted the school nutrition environment tremendously. And the photos here do not represent social distancing or how schools are currently being served at many schools. But we also know that meal participation has been down across the nation this school year due to many complex interrelated factors. However, the role of federal nutrition programs in reducing food insecurity among school-age children and adolescents remains critical to providing our youth with the nutrition security they need to grow and learn. School meal programs provide a good diet quality, and diet quality is important in ensuring nutrition security. In a recent report, the FAO defined diet quality as being comprised of 4 key aspects: variety and diversity within and across the food groups, adequacy, meaning sufficiency of nutrients or food groups compared with requirements, moderation, foods and nutrients that should be consumed with restraint, and overall balance, composition of macronutrient intake. School meals are designed to be high in diet quality and contains a balanced, diverse, and appropriate selection of nutrient-dense foods for students to eat to meet their nutritional needs. School meals are designed to help close the nutrition gap that exists here in the US. This chart demonstrates that the majority of children and adults do not eat the food groups recommended in the dietary guidelines. For example, you can see here that fruits and vegetables and dairy are underconsumed food groups. And this creates nutritional gaps for students. And to close these gaps, particularly in our resource and underserved communities, school meals and nutrition education happening in schools are designed to help improve access and knowledge to help form healthy eating habits to increase intake of these nutrient-dense foods currently being underconsumed. There are key nutrients that are necessary to support cognitive and neural development, particularly during infancy and early childhood. School-age children are also need a variety of nutrient-dense foods to meet their growth needs. These key nutrients are shown here on this chart. These are found in these nutrients are found in nutrient-dense foods that come from both high-quality plant and animal source foods. Looking at research on trends in food sources and diet quality among US children and adults was published in the April 2021 Journal of the American Medical Association. What their research found is that school food is often given a bad rap, but the study showed that it can be the healthiest meals children eat in a day. Nutrition quality was measured using multiple scales, including the United States Department of Agriculture's Healthy Eating Index. And that index looks at many adequacy components and then also 4 moderation components. But what they did find is that diet quality of foods from schools increased significantly and provided the highest overall diet quality of any major food source, including foods consumed at home and at restaurants. Programs like the school breakfast and lunch programs followed established guidelines based on research to promote nutritious choices, which set children up for optimal learning and are designed to provide children with the nutrition security they need. So far, I've shared research demonstrating that mental health outcomes in children and teens are influenced by food security, and school nutrition programs are a critical access point for food security. Because children experience hunger, may experience many negative mental and behavioral outcomes, federal nutrition programs like the school nutrition program and our summer meals programs are critical for students to learn and thrive. And I encourage you as a school wellness champion to include supports for your school meal program in your school wellness plan. In addition to accessing food at school, teaching nutrition education can increase acceptability of healthy school meals, support school food services efforts, and align with the social and emotional learning happening in schools. In the US, students receive less than 8 hours of the 40 to 50 hours of recommended nutrition education needed to support behavior change each year. We have an opportunity to improve the amount of nutrition education students receive. Nutrition education can play a part of a larger systems approach to health delivered in combination with healthy foods provided through the school program. It can exist in a variety of learning settings with diverse audience, from the classroom to school gardens, to even connecting with the communities through farmers market. Nutrition education has the power to positively change individuals, their families, and the communities. And don't forget, goals for nutrition education is a requirement of your local school wellness policy. Nutrition education not only helps students gain knowledge on healthy eating, it can also help them access food. I encourage you to read Scott Brown's blog on our website. He is a middle school PE teacher in the Fresno area, and he has been teaching nutrition education for many years. And with the pandemic and moving to an online platform, he realized in his school where most of the kids qualify for free and reduced meals, that food access was probably a challenge. And so he used his nutrition lessons to help identify students and families who needed access to food during this past year. And through his creative use of nutrition education, he was able to help over 70 families access food during the pandemic. I also want to share with you a news clip from Alhambra Unified School District. I'm not going to play it, but I will include it in the notes and you can watch it. Vivian Watts is the Alhambra Unified School District Food Service Director, and she's being recognized for a congressional award for her services this past year in feeding the community. And what's really heartfelt in this is that she also talks about the importance of recognizing the toll this has had on school food service professionals. And as you start to look at your WISC model and looking at how you're supporting the whole school and the whole community, don't forget about your school food service professionals who are also affected physically and emotionally by the challenges of this past year. School food service for the first time are being recognized for their contributions to student health and education, and are finding ways to support them is equally important. As I end my presentation today, I'd like to share a few resources with you to help support your wellness efforts. The first is the online professional learning for school food service on taking care of themselves. It helps walk them through ways that they can improve their own wellness so that they can be ready to help serve the students in their community. Another resource that I would encourage you to look at is the Stay Strong campaign by Got Milk. It's also in combination with No Kid Hungry. They're working together. And they worked with a Mexican animator, painter, and writer, George Gutierrez, to develop the Stay Strong posters and coloring sheets, which you can use for free. And it sends the message that we're all in it together, and taking care of ourselves is important. And the last resource that I would like to encourage you to look at is to learn more about school meals and student health by watching this free 15-minute video webinar on a pediatrician's perspective on the importance of nutrition and brain development. And you can access the resources as well as the webinar on the School Nutrition Association's website, and we'll provide you with the links to that following this webinar. I want to leave you with the thought that school meals are about more than just the food. We have discussed that beyond food security, school meals has a positive association with mental health outcomes in children and teens, and that schools can help support nutrition security by making sure that students have access to school meal programs. We know that students all across the state depend on school meals, and even in the best of times, these meals may be the only food that food insecure students get during the day. With the pandemic continuing to disrupt our lives and the economy, school meals are an even more important source of healthy foods for our children. Free school meals for reduce the prevalence of food insecurity. They also teach life skills of healthy eating, are part of your social emotional learning program, and are so important given that what we know about the mental and physical effects. So with that, I would like to thank you for your time and turn it over for Crystal Young to present the rest of our presentation today.
Thank you, Shannon. Again, I just wanted to introduce myself. I'm Crystal Young from the California Department of Education Nutrition Services Division. And I've been with Nutrition Services since the rollout of the Healthy Hunger Free Kids Act. We were implementing the menu certification and new meal pattern back in 2012. And prior to that, I worked in Hennepin County or Minneapolis, St. Paul, Minnesota, in a number of cross-sector intervention programs involving the Hennepin County Attorney's Office, Hennepin County Juvenile Probation, and Minneapolis Public Schools. My work with youth and wellness began as a program coordinator with the Twin Cities Union Gospel Mission, running after school programs and summer programs for youth, school-age youth from 6 to 18. Today, my objective is to share with you a few areas. First, I'm going to reflect on some of the trends in school health as Shannon did, and wellness and impact of the novel coronavirus or COVID-19 pandemic. And then I'll discuss the current adverse childhood experiences or ACE research and how it supports integrating social emotional learning and SEL. or SEL, and nutrition wellness services. Another objective I have for today is really to elevate the relevance of local school wellness policies during the COVID-19 pandemic as schools reopen, and to demonstrate how leveraging the local school wellness policy, or LSWP, can strengthen a coordinated one system approach to improving student outcomes. The LSWP was established by the Child Nutrition WIC Reauthorization Act of 2004. All local educational agencies, or LEAs, participating in the National School Lunch Program were required to adopt local school wellness policies by 2006. The Healthy Hunger Free Kids Act, or HHFKA, then added new provisions to strengthen local school wellness policies related to implementation, evaluation, and public reporting. By 2017, LEAs were to revise their policies and complete a triennial assessment by 2020. This triennial assessment was delayed by the COVID-19. Over a third of our sponsors opted in for the waiver to postpone their triennial assessments until the 2021 school year. So we've had quite some time to assess how effective our policies have been in practice. However, we may not need to wait on such measures like the triennial assessment to determine the state of wellness in our communities. This slide includes a family from the Masai tribe in Africa. In Africa, the Masai warrior tribe focuses on one question when addressing the leaders to determine whether the priorities of protecting the young are in place. They ask, "So, how are the children?" And if they respond, "All the children are well," it means that even the daily struggles of existence, even among the poor, have not kept them from their purpose to establish peace and safety for their young. This slide includes a graph of the national obesity rate for adults and children from 1974 to 2018. So, how are the children? The National Health and Nutrition Examination Survey reported that youth and adult obesity rates have increased since 1988. The most recently reported national rate for children reported is 19.3%. Children were following similar trend lines to adults from 1998 until about 2004, where youth obesity rates begin to flatten while adult rates steadily increases. Research findings also indicate that family factors contribute to child obesity disparities. For example, the American Psychological Association published an article in June 2016 in which researchers found that parents' body mass index, or BMI, is predictive of children's BMI, and that children model their parents' or caregivers' unhealthy eating behaviors. The adults found that this is particularly alarming given the higher prevalence of elevated BMI among racial and ethnic adults, many of whom are parents and caregivers. This slide includes a graph of the probability rate for obesity among youth in poverty and youth not in poverty from 2008 to 2018. The bottom line reflects the odds of having obesity for youth not in poverty, and the top line reflects the odds of obesity for youth living in poverty. The chart is divided by a dotted line in the middle to indicate the point in which HHFKA was implemented in 2012, from which the line splits into a dotted line showing the predicted trend line for the risk of obesity increasing among children in poverty, and a solid line showing the actual risk of obesity decreasing significantly. Therefore, the data suggests that HHFKA changes in policy and implementation have assisted in mitigating childhood obesity. This graph comes from a Harvard study of the National Health and Nutrition Examination Survey data published in the Health Affairs in 2020, which found that within a few years of HHFKA's implementation for school meals and snacks, youth in poverty saw their odds of having obesity reduced by 9% each year, and suggested that by 2018, their risk of obesity would have been 47% higher if there had been no legislation. They estimated that in 2018, this meant that over 500,000 fewer cases of obesity of children among children in poverty. However, there continues to be persistent disparities in the risk of obesity for adolescents, girls, Hispanic and African American youth, and children of low socioeconomic status. The Robert Wood Johnson Foundation reported an analysis conducted in June 2020 that links the COVID-19 pandemic with a dramatic increase in food insecurity, finding that about 14 million US children, or 16.5% of households with children, do not have enough food to eat. And Black and Hispanic children have the highest rates of food insecurity. About 3 in 10 Black households and 1 in 4 Hispanic households do not have enough food, compared to just under 1 in 10 white households. Coincidentally, the analysis reported that people of color not only have higher rates of obesity, but are disproportionately impacted by COVID-19. They are more likely to experience higher rates of hospitalization and death due to the infection over whites. In the Masai tribe, this information would have required a declaration of a state of emergency. How about the children? What are they saying? Have you asked them? In California, we conduct a biennial California Healthy Kids Survey, or CHKS, one of the largest statewide student surveys in the country. The survey reflects student attitudes regarding social emotional wellness, health risk behaviors, and overall connectedness to schools that can impact school climate, pupil engagement, and academic achievement. We just received the California Healthy Kids Survey results from the 2017-19 school year, covering a period prior to the COVID-19 pandemic. The results reported perceived school safety dropped markedly in all grades to the lowest rates in the last 6 years. Only 54% felt safe or very safe at school, compared to 61% in 2015 to 17. These findings also showed reports of experiencing chronic sadness or hopelessness rose in all 3 grades, to 30% in 7th grade, 33% in 9th grade, and 37% in 11th grade, the highest levels reported in the past 6 years and before the pandemic. One of our steps in the California Local School Wellness Policy Collaborative was to take a strategic approach for the 2021 school year and hold a meeting with 7 students from across California to hear their recommendations and concerns about school wellness. I want to take a few minutes to honor their voices. Ariana told us, recognized students and families have gone through more than a pandemic while schools have been closed. Be prepared to handle hostility that has risen due to social injustice. Students may have lost friends and trusted adults. Hunter told us, suicide and drug overdose is happening. Prevention measures need to be put into place. Bring back programs that raise awareness of dangers of drug use. Provide suicide prevention programs on school campuses and integrate it into the curriculum. And Jeremy told us, since schools and sports have been shut down, students like me are feeling the disconnect. We once had our PE teachers and team coaches that encouraged us to eat healthy, get our 60 minutes of physical activity in each day. Not only did this help us in areas of physical fitness and healthy eating, but it also in mental and emotional health. Thankfully, our state superintendent, who has 2 teenage daughters of his own, understands the value of listening to our children. In response to the California Healthy Kids Survey, he wrote, the students who reported feelings, hopelessness, or sad when they participated in the survey may have been grappling with those issues at more intense levels now due to the disruption caused by the coronavirus, social and racial unrest, and increased trauma. Thurman said, even though some schools are physically closed, it is imperative that students have access to school-based mental health services and support, and that school staff do what they can to maintain connections with students during this challenging time. And so, as I listen to their voices, I want us to all think that, these things that they've mentioned are really not problems, but perhaps symptoms of a greater problem, but a problem that we actually can intervene and find solutions for. And that's one of the reasons I appreciate the resilience research that has come out in the last few decades, because it acknowledges that for all people and for all times, there will be challenging times, but we as individuals and communities can maintain peace and safety amid the daily struggles of existence. Although much time has passed that we've known that not all of our children are well, the current state of emergency has brought childhood well-being to the forefront of our leadership and governors. The original Kaiser study in 1998 suggested that adverse childhood experiences, or ACE, increases risk for diabetes, heart disease, and obesity, and other poor health outcomes linked to early morbidity. Adverse childhood events can be defined as any traumatic, disturbing, or stressful event that causes a disruption in normal childhood development. The three main sources are household, community, and environment. According to a group of researchers from the University of Minnesota School of Public Health, these events may be either short-term or ongoing, but in either case, they must create in the child a sense of powerlessness and the belief that their physical or psychological safety is compromised. Let's quickly examine each of these three areas. You can silently assess where you may have been exposed to early childhood trauma, or you may consider the probability of exposure for the children in the community that you serve. The tree full of leaves represents household trauma, including divorce, homelessness, parental mental illness, alcoholism, drug abuse, emotional and sexual abuse, domestic violence, maternal depression, bullying, incarceration, and physical and emotional neglect. Below the tree is a large system of roots representing community trauma, such as historical trauma, substandard schools, structural racism, lack of social capital and mobility, poor water and air quality, violence, poverty, substandard wages, poor housing quality and affordability, and lack of jobs. And lastly, the whirling tornado represents the environmental crisis and disasters, which we are all too familiar with in California, including record heat and droughts, wildfires and smoke, record storms, flooding and mudslides, sea level rise, tornadoes and hurricanes, volcanic eruptions and tsunamis, and earthquakes. Pediatrician and current Surgeon General of California, Dr. Nadine Burke, who expanded ACE research in her early baby study, found obesity was 15% higher among children exposed to 4 or more ACE compared to those with none. In contrast to the Kaiser study, the Bayview community consisted of youth who shared in the same environmental risk factors of low income, low education, and violence, and therefore identified neighborhood risk factors may contribute to trauma exposure that increases risk for poor health and behavior outcomes. Both studies bring together the full picture of the sources and effects of ACE. I would also suggest that the key understanding to ACE research is that adversity has no respect of person. It's universal and affects us all. And I would also like to add pandemic to the infographic. One of the greatest stressors that might be affecting your schools and community is the numerous unknowns and fears related to the effects of COVID-19. We've all experienced the transitioning with online learning, limitations to physical activity, unemployment, food insecurity, social political unrest, ever-changing health and safety guidance and regulations, and more importantly, the loss of human touch and some of the loss of family members, coworkers, and friends. Although this may appear to be the beginning of the crisis, we do not need to wait to intervene. The physiological effects of ACE can be identified early in children, such as anxiety and depression, learning and behavior problems, and poor physical health, including asthma, obesity, and even arterial stiffness. And if we don't intervene, we can expect that the poor behavior outcomes, such as poor mental health, drug and alcohol abuse, unsafe sexual activity, delinquent behavior and incarceration, and suicide, are going to increase among the entire population. My goal is not to send you home today feeling hopeless, but rather to understand why. Now is the opportunity to re-engage in the discussion of how wellness policies, supports, and services are needed to ensure the safety and success of all students. What is a pediatrician's first response to ACE? As Shannan mentioned, it's really wellness interventions and supports, wellness screenings, access to healthcare interventions, sleep, exercise, and active lifestyle, healthy diet, mindfulness, and building healthy relationships, which means that health and wellness educators and nutrition services staff are as foundational to meeting children's psychological needs as mental health workers and psychologists. A child's relationship with a supportive and positive adult can help build resilience and help buffer them from adversity, support their development and practice of self-regulation skills, and champion health-promoting activities. Isn't that what we do in nutrition and wellness? Whether it's child nutrition programs, smarter lunchrooms, community gardens, farm to school, or health and nutrition education, and even staff and teacher well-being. Which is why it's important to articulate how nutrition and wellness services and programs not only support the basic needs and safety of our students, but how the 5 components of social emotional learning, or SEL, are critical to protecting the well-being of our school communities and ensuring successful outcomes for all students, which is what we do in nutrition. So, when social emotional support is paired with nutrition and wellness interventions, students are equipped with lifelong behavioral changes that become protective factors to the adverse effects of toxic stress. The best part is that they can be shared with the parent, family, or community. For example, parent and community engagement often occurs with wellness fairs, meal programs, food pantry programs and partnerships, physical activity challenges and events, school gardens, recipe sharing and competitions, farmers markets and California Thursdays, nutrition education, family style dining and cafeteria environment, cultural cooking and culinary classes, and health and wellness assessments. This state of emergency has provided an opportunity for an all hands on deck response. Our administrators, teachers, social workers, bus drivers, food service workers, and parents have all rose to the occasion to ensure that students can continue their education. LEAs are being challenged to transition resources in several areas in response to COVID-19 closures and have accelerated their effort to implement models that encourage one system of connected resources and supports. This is possible when LEAs align their LCAPs or local control funding priorities with whole school, whole child, whole community, or WISC approach. WISC provides the flexibility to customize the wheel of services and resources to support the student's social emotional well-being, physical health and safety, and establish long-term policies and collaborative partnerships to ensure equity and access. For example, the CDE local control funding formula whole child resource map aligns priorities like course access, student achievement, expelled youth, school climate, and student engagement with WISC components to identify resources, supports that ensure students are healthy, safe, engaged, challenged, and supported from cradle to career. What about SEL? Isn't this the alternative to WIS? No, it's not just one more thing. SEL should be at the core, below the surface of all that we do. Districts can use SEL as a framework at the core of all school-wide practices and policies, curriculum and instruction, and community engagement. Research suggests that SEL through trauma-informed practices, restorative justice, self-care, and direct instruction empowers the individual and community with the skills to protect against the effects of trauma and adversity. Integrating SEL provides students with one of the key protective factors for resilience: relationships with at least one positive positive adult. I'll say it again. Relationships with at least one positive adult. Some districts in California have adopted the multi-tier system of support, or MTSS framework, that aligns with academic behavior and social and emotional learning in a fully integrated system of support for the benefit of all students. MTSS offers a guide to systemic change through intentional design and redesign of services and supports to identify and match the needs of all students. This is really the entry point to leverage change for local implementation and infrastructure, including administrative leadership, integrated educational framework, family and community engagement, and inclusive policy structure and practice. MTSS uses implementation science to assist districts in assessing the level of implementation of various programs, support, and resources that they are trying to implement. Improvement science is also applied when various programs, support, and resources are not getting the results that were intended. How to do that? You stop and ask why and apply the Plan, Do, Study, Act cycle to decide if you should persevere or pivot. While WISC, SEL, and MTSS offer frameworks to guide districts to provide equitable resources, service, and education to improve students' academic and lifelong outcomes, the local school wellness policy is a tool that can transform that vision into action. The local school wellness policy requires school districts operating the National School Lunch Program and School Breakfast Program to implement a local school wellness policy. At minimum, a district's wellness policy must include goals for student wellness, specifically goals for nutrition education, goals for nutrition promotion, goals for physical activity, goals for other school-based activities that promote student wellness, such as coordinating mental health services, food pantries, dental and health screenings, and drug and tobacco use prevention. It must also include standards for all food and beverages provided, which includes foods sold, such as through the school meal program, or through competitive foods, as well as foods that are given away, such as through classroom parties or rewards. The policy must also include language surrounding the marketing and advertising of foods and beverages. LSWPs also go beyond goal setting and require accountability and transparency and assessment. It must identify who is responsible for implementation and oversight of the wellness policy to ensure schools' compliance with the policy. The policy must include a description of the manner in which parents, students, representatives of the school food authority, teachers of physical education, school health professionals, the school board, school administrators, and the general public are provided an opportunity to participate in the development, implementation, and periodic review and update of their local school wellness policy. And lastly, each district is responsible for providing a brief annual update, as well as a comprehensive 3-year assessment evaluation of how the policy is working in the district. As I mentioned before, the triennial assessment. Which is why the California Local School Wellness Policy Collaborative is encouraging districts to leverage the local school wellness policy as a tool to support continuous improvement and a coordinated implementation in all areas of school wellness. This year, we are asking superintendents, administrators, curriculum and instruction coordinators, and student support services to consider building or reconvening a diverse wellness committee of district and community stakeholders, including school administrators, school nurses, curriculum directors, teachers, child nutrition professionals, health and physical education teachers, parents, students, healthcare and mental health agencies, and food and nutrition agencies. Consider addressing the needs of the whole child amid COVID-19 pandemic by actively engaging youth and community in the development, implementation, and evaluation of local school wellness policies, and of course, elevating their voices. Consider strengthening policy language or expanding implementation goals using the WIS components. And lastly, consider integrating the local school wellness policy with other high priority district initiatives such as LCAP, MTSS, SEL, and positive behavior interventions and supports to improve student achievement and engagement by mitigating the barriers to learning. And of course, I'm going to challenge you to do the same. You've started by being on this call, but let's take a minute to consider 10 components of the WIS model. Which areas need additional resources and supports in your district? As you think about these areas, I want to share with you some more of our local school wellness policy collaborative resources. At the CDE, we have a local school wellness policy webpage, which link is available on and will be available in the slides, or if you want in the chat box. We also have our California Local School Wellness Policy Collaborative webpage at thehealthyeating.org. And then, as I mentioned in the slide before, there's a CDE local school wellness, local control funding formula whole child resource map page where you can find additional resources that the CDE has gathered to support the whole child. For more SEL resources that is supported by the CDE, please check out the Center for Disease Control, School Nutrition and Social and Emotional Climate and Learning PDF that Shannan showed us earlier. The CDE's Creating an Emotionally Healthy and Safe Child Nutrition Environment in Challenging Times PDF, available on the COVID-19 Guidance for Child Nutrition Programs webpage, as well as the CDE Social and Emotional Support for Distance Learning webpage. Hopefully our presentations today have helped us to understand that it's time to go deeper in school nutrition and be courageous facing adversity for the sake of all children. To leave you with a few recommendations for next steps, I have summarized recommendations from the Castle Cares Initiative. The Castle Cares Initiative has provided a roadmap for schools and agencies to determine how to integrate SEL in their strategic planning in response to the COVID-19 pandemic. This document provides practical strategies and a huge bank of SEL resources to assist you in making sure your efforts are not only sustainable, but also relevant. So remember, strengthen community partnerships, engage youth and community and elevate their voices, and care for the adult caregiver. And lastly, put on your equity shoes. Thank you. At this time, we have a few questions that are in the Q&A that we can answer. If you have not entered a question, you're welcome to do that now, or you can follow up with us on the California Local School Wellness Policy Collaborative webpage, as well as sign up for our newsletter for the next Winning at Wellness webinar.
Crystal, there is a question in the Q&A box. It says presently there are many grandparents involved in their grandkids due to the different circumstances. Are there any programs to help the grandparents, the families, with children's trauma?
That's a great question. I don't know of particular programs geared toward grandparents in particular, but I would reach out to your district school social worker to let them know about that dynamic and then see what resources they might be able to connect you with within the community. This is very much a real dynamic in our society today. And so a lot of the mental health programs and community programs are familiar with that. And so they might be the next reaching out to your school, or may help you to make that next connect within the community. And then of course you have your nonprofit community that can also help, like local community churches or wellness centers that might have connections with the integrated household kind of dynamic families. So and know how to support them. Great. So some folks online, feel free to share some resources that you may have found in supporting children with trauma. There's also a really good resource that the county, sorry, I can't think right now, that the state has put out during COVID-19 that does have resources available. If you look up for California's COVID-19 support, they have a lot of resources for parents and families there as well. And then we also have California for Action for Healthy Kids. They have a number of resources on their website as well for families.
And then Amanda put in that Sharp Mesa Vista Hospital in San Diego does emotional wellness classes for family members. And then, yep, there it is. And then just to remember that grandparents are all part of the family. So any courses that school districts are offering for the families do include those grandparents.
Just want to thank you all today for joining Shannan and I. And if you would like to reach out to me directly, you're welcome to do so. My email is cyoung@cde.ca.gov, and we can help you with connecting with any other of our members of the collaborative as well. And this institution is an equal opportunity provider. Thank you.
And then I just put in the chat box how they can access me as well. So thank you all for joining us today. And with that, Jerry, you can go ahead and close out.
Thank you so much for those of you who attended our Winning at Wellness webinar today. That concludes our presentation. And as mentioned earlier, we will send out a link for today's presentation if you would like to watch it again or share it amongst your colleagues. So have a great rest of your week and day, and thank you so much.